Good evening, everybody. On behalf of Sri Devaraja's Academy of Higher Education and Research, the University Center of Health Professions Education is pleased to conduct this webinar on programmatic assessment. Programmatic assessment, as we all know, has been a new terminology which we are all trying to understand better. This topic is highly relevant and a timely topic for this era because audience here who are participating today are involved both in medical and health education. This assessment method is integral to all the modern educational strategies that we are talking about, focusing on the continuous and holistic evaluation of students throughout their education, that means throughout their program, rather than through isolated tests. This supports the comprehensive understanding of a student's development and competence, aligning closely with the realities of healthcare professions, where continuous learning and adaptation are critical. We know that one of the role of Indian medical graduate is a lifelong learner. So by exploring the programmatic assessment, this webinar will provide valuable insights into enhancing the educational practices to better prepare students for real-world clinical challenges, ensuring that they are not only knowledgeable, but also skilled and competent. So we want to prepare reflective practitioners, and this is particularly crucial in health professions education because the quality of training directly impacts patient care and health outcomes. I'm so glad that Dr. Prattama has agreed to be with us today, and I request our Director of Academics, Dr. Sarala, to introduce the speaker to all of you. Over to Dr. Sarala.
Good evening, everybody. I take this opportunity to introduce Prattama. He is Assistant Professor in Department of Medical Education and Bioethics, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. He completed his Masters in Health Professional Education from the University of Western Australia in 2018 and obtained his MD in 2013 from UGM. He practices as emergency physician. Prattama has completed his International FAIMER Institute Fellowship in Philadelphia 2019. He is the managing editor of the Indonesian Journal of Medical Education. His research interest is in health profession education and general medicine, particularly social accountability in medical education, teaching, learning in medicine, programmatic assessment, and interprofessional education. Prattama is a faculty and a project advisor at the International FAIMER Institute. This is in brief about Prattama. Over to Prattama for this session now. Thank you.
Thank you, Dr. Sarala. I will share my screen. Okay, I hope it's visible now. So first of all,
yes, it's visible.
Thank you, Dr. Sarala. First of all, good evening for all distinguished participants, and thank you for allowing your time to join today's webinar. Despite this is your taking part of your family time. So tonight, we will discuss a little bit about programmatic assessment in health professions education, and this will not explain everything about programmatic assessment because programmatic assessment is really a complex matter and complex issue in health profession education. But I will try to touch the essential part and principles based on the latest consensus on programmatic assessment in health profession education. My name is Prattama Santoso Utomo. You can call me Tama. That's my usually people call me Tama, but Prattama is also fine. So this upcoming 40 minutes, maybe approximately, we will discuss a bit about the definition and rationale why we need to move or embrace programmatic assessment for health profession education? And then how should we implement programmatic assessment for health profession education in our context? Because I believe all of us, including all of you, already know about kinds of instruments of assessment, how we can use them to ensure they're programmatic. So at first, I'd like to ask your opinion in the chat room while I'll proceeding to the next to the presentation. Why do you think programmatic assessment is important for health profession education? If you mind sharing your thoughts about this based on this question in chat function, and discuss it later throughout the presentation. And should you have any questions, you can also address them in the you can also share them in the chat room so that we can address them later during the question and answer session. I'd like to start by this picture, right? This is an MRI, it's a brain MRI. So usually as health professionals, we also always talk and always doing diagnostic procedures, right? We are trying to help our patient define and diagnose what is the condition of our patient. So when we are trying to diagnose our patient, we have those kind of questions, right? We have those list of questions, maybe even more, right? What test or examination that we need to do to the patient? How many slices, for example, for this MRI that we have to do? When you see this MRI, what planes or orientation of the pictures are, or the image are? What are the modalities? Is T1, flare, T2, or other thing, right? When is it best executed? Is it early after the symptom or late symptom, several hours after the symptom? This is something that we also have questioned before. Who should interpret the result? Should it be neurologists or emergency physicians can do that in some times, or radiologists? What happen if the radiologist is not on spot or something like that? And how should we inform patient about the result of our diagnostic procedure? So those are some aspects that we always grapple when we do diagnostic procedure. To make this as analog and similar with assessments. So, for example, we can see here the picture of people attending simulation doing, like you can see, doing back mask ventilation, intubation, and also airway ventilation here. Looking at this competency, we should have some questions too. How can we assess the competency? What tests or examination should we do? Similar with the previous one with the MRI, right? How many occurrences, how many times should we assess them to ensure that they have the competency to save patients with a respiratory failure? What are appropriate test items or instruments that we can use for assessing the competency? And when it best assessed? Is it early in the education year or later after doing some years of their training? Who should assess the students? Is it doctors, nurses, or maybe a member or peers, something like that? And then how do students actually receive feedback based on our assessment and our rates or points that assigned to them? Those are also this question for assessment that's related to diagnosing how students actually performing certain competency. I think this is very familiar. All of you are familiar with this one, the Miller pyramid of learning evaluation, and the right-hand side is actually the list of assessment instruments. I will not explain each of them because I believe UCHPE already has a separate webinar for assessments. So we can see that here that we have many kinds of assessment. I believe we at least use some of them in our program, and even more even there are other assignments that I cannot list here due to the space, right? And this is correspond on assessing knows how, knows, shows how, and does on the pyramid. So the question is actually, are those assessments adequate to measure the competency? This has been a grapple and yes, a debate in medical education and health profession education in academia about ensuring that assessment instruments are actually adequate to assess certain competency and to decide whether or not a trainee or a student actually has achieved certain competency. So this notion actually proceed and then progress to the introduction of programmatic assessment in 2000, approximately 2005 by Professor Chis van der Vleuten in Maastricht University. So programmatic assessment is viewing assessment as a system. So assessment is not an item or an instrument, but this is a system of a whole. So this is not a separate program. So assessment will not be separated with learning activities. Assessment will not be separated with the curriculum. So this is the notion of programmatic assessment. So sometimes even when we are learning about assessment, we have this triangle and then saying that, look, for knows competency, we do this. For knows how competency, we do that. This is actually really separating the learning process and the assessment process. In programmatic assessment, we really want to combine all of them together. So this is the definition that I really like from Shot et al., explaining that programmatic assessment is a very specific approach designing assessment with the aim of simultaneously optimize decision-making and learning. So the goal of the assessment itself is not judging the students. We do want to judge them sometimes, but the goal actually to make sure that we are having good decision making of the student competency and while also providing learning opportunities for the student. So this is really how when in healthcare we change or move from doctor or provider-centered care to patient-centered care. This is where for learning we move from the university or from teacher-centered care, teacher-centered learning to student-centered learning. So why we need to see programmatic assessment or assessment as a system? Because this problem actually, I believe maybe some of you are already familiar with this table from Van Vleuten and Stewart in 2005, saying that each assessment instrument has different reliability, right? As we know that each assessment item actually has suitability with certain competency or certain level of knowledge or skills, they also has different reliability. And medical education has, health professional education has a limited time to examine. Let's see multiple choice question. I believe all of you, right? I can claim maybe all of you use multiple choice question in your courses or in your program. Please. If we do multiple choice question test for an hour, so if approximately 50 to 60 items, the reliability of the testing is only 0.62. So it means that there are still room for variability. And then when a multiple choice question can be reliable is we do that for 8 hours. So how you can make a student to do test for 8 hours, right? This is like a full day test. It will be stressful for the students and will be stressful for us too as the teachers to create so many questions or so many items with students. It is not included also. We should also think about the reliability of each question, retest reliability, internal consistency, and thing before taking this one. So adding those burden. OSCE is very familiar too for us for skills and simulated learning assessment. So 1 hour OSCE is on reliability is only 0.54. 2 hours 0.62. 8 hours is 0.9. We can imagine how expensive will be doing OSCE for 8 hours straight and how will be stressful and exhaustive for the students. Even when I had in Indonesia, we had national OSCE examination.
Progress.
When student for 10 hours, it was very stressful for the student and very stressful and tiring for us to the examiner. And then another example is mini CEX. Mini CEX usually used for workplace-based learning, right? This is while having better reliability is still 0.73 for the first hour of reliability. It means that each different assessment has different reliability and cannot be perfect, right? Unless the assessment actually conducted in a long time and several times. This is what this table really want to say from this journal. So departing from this issue of the reliability on and maybe with what we call the disadvantage or the pitfall of each instrument, Van der Vleuten and colleagues actually devised this suggestion assessment as a system. So in programmatic assessment, we arrange assessment methods. We will try to arrange all of those assessment methods or instrument for the purpose. So fitness for the purpose. When you are choosing or recruiting someone, part of our team in healthcare, we do fit for purpose tests, something like that. We are also doing that for assignments and assessment. So in this term, as programmatic assessment, individual assessment will be a data point. So doing MCQ examination is not the end of the assessment process, right? Sometimes we have block examination with MCQ, but this is not the end of the block itself. This is part of the assessment. This is actually a data point of the assessment system. And in the programmatic assessment approach, assessment is viewed as an instructional design. This is something that a bit different with the previous view of assessment, where assessment is actually evaluating the learning process. But in programmatic assessment, assessment is actually part of the learning process. Assessment is actually part of the instructional design. We can teach using the assessment, right? Assessment is not assessing what we teach, but actually something that we can use to teach. This is something that we need to consider too. So in general, programmatic assessment has 5 components. So I will use those abbreviations later on. Programmatic assessment is PA. So first, training or learning activities, LA, and then assessment activities. So I will not say this assessment only because assessment activities and learning activities. So this is parallel and a similar level. And then supporting activities, intermediate evaluation, and final evaluation. So those are 5 main components of programmatic assessment. And we will discuss this more in depth during this presentation. So this is how to make programmatic assessment an instructional model, right? Instructional design, I'm sorry. You can see this is like a curriculum map, right? All of you maybe know the curriculum map of our undergraduate medical program, curriculum map of our public health master's program, something like that. We do have similar format for curriculum map. We can see here that programmatic assessment is actually not talking about assessment itself, but actually combining active learning activities, supporting activities, also part of the assessment system. So this is really a system rather than a one-point assessment or one-point judgment, right? And to use this model, actually, we implement this in Indonesia. We also had a study to create a portfolio in Indonesia for undergraduate medical schools. We are currently in pilot project of this research and implementation. We try to list many different learning activities, and also supporting activities in Indonesian medical schools, right? We have lectures, tutorials, practical sessions, field trip, clinical skills, and materials. For assessment, we have MCQ, SOCA, OSCE, and others. We do list our supporting activities: reflection, planning, mentoring, academic advisory. This is one of the important thing. And then advice, and also supervision in clinical practice and clinical education. We need to have another evaluation. So we do need to have intermediate evaluation. And then after intermediate evaluation, we will do another set of learning activities, assessment, support activities before doing the final evaluation. And this will be combined with reflection, feedback, and documentation, and documenting them in portfolio. We'll discuss about this later on. So this is how we interpret the model from Van der Vleuten et al. In our context. I believe we have learning activities also in your programs. You have many learning activities, assessment activities, and supporting activities. How should we combine them to make sure that they are fit with the building of programmatic assessment? So to make sure those aspects actually fit with programmatic assessment model, we have what we call recommendation for programmatic assessment. This is the revised one from the 2015 recommendation. So this is the 2020 consensus of programmatic assessment. There are 12 recommendations. So medical education and health professional education loves 12 tips. So that's why we have 12 recommendations here. I don't know. This is very maybe a secret number in health professional education. 12 tips, 12 recommendations, something like that. And then we can see that each recommendation, we can correspond them into programmatic assessment components, right? Academic activities, and then learning activities, supporting activities, intermediate evaluation, and also the final evaluation. So I will not explain or discuss all of them, but we can take some examples that are practical for us to use later on. So first is really combining, integrating assessment and learning activities, right? So from this part, actually, we combine recommendation number 1, number 2, number 4, and number 5, right? So how to make sure that educational justification is given for all assessment and also learning activities. So our question is actually why we should do this. Why we should integrate assessment and learning activities? Because we usually have our positivity mindset that everything should be different, but actually combining them is a measure to achieve assessment drive learning. Because as you maybe already know that assessment drive learning is actually the principle of good assessment, right? I think I will not explain that further because this is already explained maybe in other webinars. So what are the features of assessment drive learning? Actually, first, we have to integrate learning and assessment. This is the first step. This is again, and again will be reiterated here. And then we need to provide constructive and continuous feedback for ensuring that our assessment drives learning, not only providing, look, this is your score is 80, good. Your score is 95, excellent. Your score is 55, need for improvement. So we have to provide feedback for them. What, if we say you need for improvement, what improvement that you need to do? If it's already good, 95, so you just have 5 points short from the maximum score. What should you do? And what are the 95% aspects that you already did well? Something that can improve and make sure that the student understand why I received this score and what has been done well and what that they need to improve later on. Feedback actually really mediating to learners, right? Improving the skills for the learners to appraise the assessment, to see that the assessment is actually their partner to grow, not only like a judgment for that kind of scores. And then also to perceive agency, where their level of competence now, how are actually they progressing throughout the course, 4-year course, 3-year course, or 5-year course. How is it compared to the intended learning outcomes or intended competency achievement within the time frame that they already done and other else. And also it relates also with the interpersonal factors, right? How with the feedback student can improve themselves, can actually interact with other students, learn with others, which achieve better to also promote cooperative and collaborative learning with others, and also how they can seek help to advisors or lecturers or professors in order to consult their learning issues or learning preferences. This is where assessment drives learning is very important, and combining assessment and learning activities will be one of the method. And this is very important that assessment and learning activities combined together, we show progression throughout time, right? Sometimes maybe in the first semester during lectures, for example, I would say lectures, students are silent. But after several lectures, after several semesters, they will show like they can answer question, they can respond to our probe in our lecture. So it's showing their progression through teaching process, right? During simulation is actually another simple example. In the first simulation of we use the first picture, the first simulation of airway management for emergency patient, maybe students or learner could not do much or doing many had many mistake on the important steps of resuscitation. But after several months of learning or for several semesters of learning, we can see that using simulation as a learning process actually showing the progression and providing also assessment opportunity to see that they are actually progressing better with the process and showing that they are learning something during our education courses. And again, one kind of assessment never enough to decide someone fail or pass. So it would be unfair for the student when we only use one assessment instrument to decide whether you are actually passing or failing certain course. We need to have different assessment items, and we need to allocate a certain percentage or certain a weight on each assessment, providing the best estimate of validity and reliability on each assessment instrument. So integrating learning activity and assessment activities actually could be interesting and could be challenging at a time. So when we want to integrate them, we have to make sure that every learning activity has opportunity for assessment. So if we don't have if we only use traditional learning activities, we will have no opportunity to assess students. So we should make sure that students are engaged and active in our learning activity. We can do many things for that. One of the recommendations is actually to provide inquiry-based learning. So making real-world connection with asking high-level questioning to students. For example, I'm trying to ask you with the first question, why we should use programmatic assessment. This is how we ask students to engage to our presentation or engage to our topic, right? So engaging and entertaining is a little bit different. So being funny, using technology, and using those kind of nitty-gritty, interesting surveys actually mean to not only to engage but also to provide interesting and also entertaining way to elevate boredom. But engagement not always related with entertaining. Okay, so inquiry-based learning actually asking students to critically think something so that during the learning activity, student will have control on the learning outcomes itself. We use some questions that can trigger students' critical thinking and actually relates to the learning objective of our session or our course itself. And assessment is not always a test, right? Yes, MCQ is an assessment, but assessment is not always a test. When we ask student with question and we can see they are answering our question and those actually correct, we can see that this is already an assessment, right? From this presentation, from the answer from my first question, I can see that you or some of you who respond, I already know that you already know about programmatic assessment. So I can assess that you know about programmatic assessment, right? So this is how we can assess students, because we don't have to teach everything, right? We just need to teach something that student doesn't know. This is something that we need to embrace. So that's why we should combine those three pyramids, right? The middle and right pyramid, Bloom taxonomy and learning pyramid is very common, but I'm trying to invert the Miller pyramid this way to see that, look, if we actually ask students to do something, right, the orange part, actually we are assessing those aspect and also teaching, creating aspect. So while we are asking students to discuss or to practice something, to try something, to simulate something, or to teach something to other, right? What do you know about blah, blah, blah? Can you explain to your friends here about the process of resuscitation in trauma patients, something like that? We ask them to teach. It means that they are doing something and they are actually creating something to teach, right? This is actually really aiming for the higher Bloom's taxonomy learning objectives, while also assessing a higher level of competences. So that's why inquiry-based learning should be part of our program. So we should limit the number of lectures, reading, because this is only focusing on remember and also knowing aspect of the assessment. And this is less inquiry-based, right? We can combine inquiry-based with lectures, of course. Lectures is not bad, but we can use lectures and combine them with inquiry, with some activities that actually engage students more, right? So engage them while entertaining them, not only entertaining them. So this is an example. If you can, do you know jigsaw activity is actually one of the most popular learning activities, collaborative learning activity in health professional education, where we combine students in groups. So they are mostly teaching each other in groups, that they are learning together in their home group, in their expert group, and then going to return to their home group and then present in their home group with different approaches, with different colors here. I mean, they have different items to present in their group, and then they learn each other there. In this kind of learning process, we can see that lecturers or instructors are not the main person to teach here. So this is very inquiry-based. This is an example that we can use, and we can assess many things, right? We can assess the decision-making skills. We can assess students' ability to explain concepts. We can assess, of course, the validity of the concepts they deliver, right? During the presentation, we can also provide feedback for them. We can also assess their peer support, their communication skills and things. So by doing this kind of jigsaw activity, without doing tests, like without doing MCQ, doing essays, doing case analysis or SOCA, right? We call it case analysis or SOCA. And then we can actually assess their competencies by observing them well. So the problem sometimes is because as a lecturer or as a professors, we are not observing well and too dependent to assessment items like MCQs or OSCE to decide that they already received those certain competency. So return to this slide, then I will once again say that those instrument items are data points only. So we cannot rely only on 1, 2, or even 3, 4, 5 assessment item only without combining them in our learning activities in our curriculum. So how we can proceed from the data points to intermediate and final evaluation? So our evaluation should be evidence-based, right? We should use multiple data points and time lapse. So we are not only doing tests once. MCQ, we can do it several times, right? Middle of the block, in the end of the block, and then we do have progress tests maybe in the end of each year. So it's showing the progression using that MCQ. It's better than only doing one in the MCQ. And it should be multi-source, right? The source of the assessment is not only from test, but also from the instructor, from the advisor, from the patient, right? And also maybe from other stakeholders, from the external reviewer or external observer and other else, right? And then we need to have to provide remediation also for intermediate and final intermediate evaluation, right? If we do proper intermediate evaluation with remediation, feedback, and then we will have students or trainee with good competency by the final evaluation. So this is why remediation should be part of the intermediate evaluation. The less high-stake examination or less high-stake assessments. So while combining those 4 aspects, we can then provide a trustworthy and credible process, right? This is the different colors actually points out different standards of credible process of measurement, ensuring that we have experts that train to provide assessment. So we need to train our assessors, right? How to create MCQ examination, how to create OSCE examination or OSCE items, how to perform mini CX, how to perform observation assessment based on jigsaw learning, for example. We need to provide that kind of training to our lecturers or our faculty members. And then how to use standards, rubrics, and milestones to make sure that our assessment rubric or assessment instrument is actually valid and reliable. And then how to provide justification for the decision. It should be evidence-based. Why we will choose this one. The Miller pyramid come to this part, saying that, okay, we use MCQ because we want to know the knowledge part, something like that. We do member checking, right? We check this with our students too, right? How do you think about this one? Why you had this achievement? Well, in your previous performance is actually you perform better. Maybe there are problems. It's error in the examination process, or maybe the students are feeling unwell during the examination. I think this is something that we need to consider for evaluation, right? How to coach the mentor and learner, right? This is using the academic mentorship and academic advising, right? And also this is something that we don't like as an appeal procedure. We also have to be fair that student can appeal, because every student have different difficulties and every student might have different problems that we as an academia or as the professors might not be able to understand without hearing their appeal. And then supporting learners. This is the final part, like the SA, supporting learner. So this is when we ask our students in one of our study in Indonesia, asking, why do you think you're stressed with what are most stressful part of your education? What do you understand? What thing need to be improved in the assessment process and the learning process in medical education in Indonesia? This is in our medical education system. Those are the feedback from our students throughout Indonesia. So lack of constructive feedback, teacher-centered learning, summative assessment had driven the curriculum. Look, this is very interesting aspect from our students, saying that feedback, reflection, and role model is very important here. And we need to also realize that health profession education is among the most stressful major in higher education, right? And we are actually educating in a very stressful environment, both in our clinical practice and in our campus too, right? That's why we must provide support for learning. How to provide supporting? support them to make sure that we can use this assessment to support students. So we can be playing both role as teacher and mentors. Right? We can teach them, but we can also provide guidance. I don't know if maybe some of you also academic advisor, but I believe so that maybe many of you also becoming a mentor or academic advisor. Those are two different aspects of being teacher and mentor, right? When we teach, we are usually focusing on our content, but when we are actually mentoring someone, we provide guidance and advice and stimulate reflection. The goal is also a bit different. While being teacher, we are focusing on ensuring the knowledge and skill development, while becoming a mentor and supporter of learning for our student, we need to think about their professional and personal development. So this is something that we need to differentiate between being teacher and being a mentor. And then how to make sure that our evaluation process is supportive for students. This is GIBS reflective cycle. It's really how we can use reflective cycle to encourage more supportive evaluation process for our students, right? So we should use evidence as a basis of advising learner. So we are not sharing our wisdom in advising learner. Looks, 15 years ago, when I was a medical student, I'm doing this one, and successful. So that's our experience. How about student experience? What happened with the students now? How are the scores of the student achievement? Which aspect that student need to be improved? This is something that we should base on. Later on, I will show you a simple tips to support student using this evidence. And then we should involve student with a reflective feedback process, not only one-way process, right? And then we can use portfolio, compile those assessments, compile those learning process, and ask students to reflect based on those. And don't forget to ensure that we need to have psychological safety to ensure that students actually learning in a supportive way, both in class and also during our advisory. When we are very intimidating students, they will be very scared to consult with us. And as an academic advisor, we might lose opportunity to nurture and also to build their professional development. This is simple tips from us, not only me, but also other team members in our research project. We call it advising like clinicians. So we use SOAP procedure, right? This is very clinical terminology, SOAP, right? A subjective, objective assessment and plan. So we start with the subjectives, asking students, right, during our advisory meeting with students, or when we are meeting with students with difficulties, we ask them their reflection of their learning achievement. We use simple reflective inquiries. What do you think? What do you feel? Any problem of difficulties that you say? It's more subjective. It's more symptoms that we are actually exploring here. Before we then start to move on the objective part of the science, right? Usually, what are the assessment results? What are the data points that we have here? Which part actually having good marks? Which one is very lower point? Which one that need to be improved, right? And then we also evaluate the achievement of the graduate outcomes, the achievement based on national or board competency, or maybe local competencies standards that you use in your country or even in your region or in your state. And then based on those S and O, sign and symptom, based on our diagnostic skills, we try to assess them during the advisory meeting and analyze the S and O aspect to diagnose the decision to progress. Are the students actually in difficulties? Are actually not in difficulty, but having like psychological needs or psychological anxiety, for example. And then we use feedback loop here. So feedback already mentioned several times in this presentation. So after we assess the problem together with the students, and then we can then plan. What should we do next, right? When we are prescribing therapy in clinician, as a clinician, we prescribe learning strategies for our students, right? Using reflective and decide when should we have follow-up. We ask our patient, so please come again after a month to evaluate your progress. We ask also our students, let's meet again another month after another month to decide whether our strategy is effective. This is something that we can use for our portfolio and our advisory meeting guideline. Then remember feedback, right? I love this quote. I use this quote many times, that without feedback, mistake go uncorrected, good performance not reinforced, and clinical competence is achieved empirically or not at all, right? Burger, very, very, very famous one, right? Sandwich or burger feedback, right? Plus, minus, delta, right? Plus and delta, we say it like that. Something that has been done well, something that need to be improved, and suggestion for improvement. However, this kind of delicious food of feedback is not easy to use, right? And I want to add, don't forget to tango, right? After eating burger, you need exercise, so you need to have tango, right? So the burger itself is not enough. Plus delta is not enough. We need to do tango. So what is tango? So this is from an interesting reading by Bing and Yu in 2018. It takes two tango to tango. It takes two to tango. Tango is the feedback itself. So providing feedback to our student is like a tango. So you cannot do tango individually, right? Tango should be a two-way dialogue. So when providing feedback, it's not only we, providers, telling students what to do. This is not a feedback. That's actually an instruction or a scolding, maybe not a feedback, right? So a feedback using any technique of feedback, right? The example that I use is the burger feedback, but maybe the other webinars already explained what types of feedback. It should be a two-way dialogue, like a tango dance, right? Tango can be improvisational and need to adapt. So both partners need to adapt. So not only us, teachers need to understand how to do tango or how to provide feedback, but we also need to empower students on receiving feedback too. This is something that we need to do. Learning a complex dance like tango is difficult without instruction and practice. So practice really makes perfect, also with feedback. So try to do feedback every time and learn from those, and actually asking students, do you have anything to add, or do you have anything to say about the feedback that I use? Is it make sense? Is it too high for you? Something like that. This is a very important thing and quite challenging, of course, providing feedback in two-way, especially in our country, like Indonesia, India, in Asian countries where power distance are high, or power gaps is really high between professor and students. Sometimes students expect instruction, but we have to change this in a two-way dialogue. And working with the dance partner over longer periods actually will improve their performance as a pair. So having same advices throughout different years is better than changing advices every semester. So this is why it's better for us to continue advising a similar group of students over a period of time rather than changing them every semester. So before ending this presentation, I like this picture. So we can use programmatic assessment for decision making. We can use a pixel. An assessment instrument is just an identified pixel, right? MCQ examination is actually just a pixel. So we have to combine those pixels all together to create a beautiful picture. So this is why we should have and use different approach of assessments to make sure that our decision making, to saying that something is beautiful, is correct and valid. And for professional development, we should do our assessment throughout the time to change a wood to a valuable sculpture, to train our students to become a very professional health professionals, right? So we need time and we need many curves, many efforts for this one. So really, we cannot do it only once and only in one time. So I'm closing this presentation with those quotes from Joe Biden and Aristotle. So not an example of a power, but the power of an example. So programmatic assessment is not the example of what is the best assessment approach, but actually the power of many different assessment items. And then what we repeatedly do excellent, then is not act bad habits. So we should change our habit in providing feedback and doing assignments and assessment, right? We should change them from doing this as a one-off activity to a more programmatic activity and providing feedback in a more tango approach rather than a single dense approach. Okay. Those are some useful references. I will share this slide later on to the committee to be distributed to all of you. And thank you very much for your attention and participation. And I'll return this to the moderator if you have any question.
Thank you, Dr. Prattama, you said I can call you. So thank you so much. It was really, I must say, exemplary. We have been doing it in bits and pieces. As I told you, like it was a part of a stream of isolated tests and then branding them as competent or not competent. We were handed over the competency-based curriculum without talking much about the assessment that aligned with it. Thank you so much. We have got a fair idea about what you have shared with us regarding this, the levels at which the assessments have to be done, and the importance of the two for tango was a good one. Like normally our teachers get a little disheartened by the non-cooperative movement of the residents. So how to go about doing it and how to put it all in a basket and then measure competency. Shall we open this for discussion? Like, can we take questions, a few questions, if you're free? Or
Sure. Yeah.
So the next, we'll take a few questions. I request the participants, either you can put it on the chat box or you can raise your hands and then you can ask Thama about what's it that you need clarity from.
I'll try to screen the chat box. Oh, there is one question from Dr. Kanak, maybe. May I just read this?
Yeah, you can do it. Yeah.
So Dr. Kanak asks, a program assessment for a learner for medical education is required to document the sequence progression of learners' competency attainments in CPME based on mastery approach. A very difficult, complicated and difficult implementation. Can we simplify it, right? Yes, it is complicated. I agree. That's why many institutions, not only in maybe India or Indonesia, but even in the US now, they are also having resistance in this kind of assessment. So what we can do to simplify it, actually to change the mindset a bit by combining those learning and assessment activities. So maybe the first thing is actually to make sure that all of our team understand that we have many kinds of assessment that we can do all together to make sure that we are not only testing the students, right? So providing feedback for the students based on the assessment that they did is actually one of the important things. So we are not only testing them and giving scores, but also providing, look, your MCQ score is 80. What happened with 80? We can say this is good. But what happened with the 20 points? This is something that they need to learn. This is where we can use the assessment to provide feedback to students. And we can use assessment to actually, an example of how to use MCQ to boost their learning process. So we can use, for example, like MCQ matriculation or MCQ, we make a table to define what our MCQ examination is actually assessing for. So for item number 1 or question number 1, what's competency that is being assessed here? So we can provide them with the feedback. So in the Indonesian national competency, national examination program, each item has those breakdown. So when student receive score, they also receive the list. So look, in cardiovascular item, you have 100%. But in psychiatry, you only have 50% achievement. So it means that in this progress test, you need later after this progresses to learn more about psychiatry. But this is still very simple. But combining this with the advisory with your academic advisor, with the student academic advisor, we can then devise the strategy to provide learning process. So this is not only about the assessment itself, but actually about how to combine this with the learning process. Oh, please, Dr. Kanak, you raise your hand.
Yeah, thank you, Dr. Tama, for a excellent presentation. I'm audible?
Yes, you're audible.
For an excellent presentation, and in fact, a very lucid answer to that question. What you brought out in the answer is, which is quite significant when you apply programmatic assessment for competency-based medical education. Number one, you talked about blueprinting of the tests, which are supposed to be properly blueprinted. And the second thing that you brought up was the rubrics, making of the rubrics to give a proper feedback so that the student progresses ahead. So if these two elements are properly utilized and apply it for the number of competencies or the outcomes that you have got, then probably you can structure it in a proper way and you can develop your own programmatic assessments for a local CBME curricula or whatever outcome-based curricula you're using. So very two important concepts, blueprinting and rubrics. Follow it with proper feedback. That is what you're talking about. Thank you.
Yes, Dr. Kanak, to emphasize that, I think that we can come. So this is I think there is another question saying that it should be in the program level or in the module level or the course level. So actually, programmatic assessment is a program, so it should be designed for all levels, right? Not only in the program level but also in the course level. Because when we are developing our curriculum, we are not thinking course by course, but actually what is a whole program, what competencies that we want to achieve for, what our graduates need to have competence on. So, and then those then broke down into different modules or maybe blocks or maybe subjects if some medical schools they use subject-based. So those systems actually combine together with learning assessment, learning activities, different teaching activities and assessment activities combined together with the supporting activities, and then we'll provide strong example or strong data for providing evaluation and feedback for the student. So it's actually, we are trying to combine both all together, not to separate each of them. This is how programmatic assessment really aims for, actually, to make it a system, not to make it as a part, right? It's not like we are doing part of, this is the hand part, this is the head, this is the chest, but we are seeing this as a system, as a human, right? In medical education, right? This is something that I think we need to emphasize and we need to think more about.
I think there's also regarding how do we progress amidst the challenges of the paradigm shift from traditional to these kind of what do you say, competency-based innovative methods, and also there's an element of resistance from faculty. Like how do you challenges? I think people would know, how did you address the challenges?
Yes, I think any kind of innovation have this challenge, right? Even to ask people to use masks for COVID has that challenge, even it's very emergency, right? So I think I will suggest that doing like this kind of seminar or doing this kind of socialization to our faculty members several times, bit by bit, will be most useful rather than doing radical implementation of this new thing, right? We can implement programmatic assessment as a continuum. Maybe we will combine as a supporting activities first. We will focus to supporting activity first. We want to combine the teaching activities and assessment activities combination first. This is something that we can do at first. And then teaching and also faculty development is usually part of them. So putting this in our agenda of our school or our institution, that having faculty development is very important in this part, right? Because without faculty development, it will be very difficult for us a part of the medical education or health professional education team to implement this, because we don't have team members, right? Team members very limited, and the other faculty might not understand the importance of this one. But by promoting this, we will try to become a change agent to promote this one. So this is the most difficult part. Explaining this is very easy, but actually asking to buy in is really important. And also one of our experience actually to buy this to the leader of our institution. Usually this is useful for like high poverty countries like India, Indonesia, Pakistan, everything like in Asian country, where high top-down approach usually have more power than the bottom-up approach. So combining this will be very was very useful for us, so that everyone can actually adapt this bit by bit. Resistance still happens though. We cannot satisfy everyone for this one, but at least we have more team members, we have more faculty that exposed and willing to embrace this and try to change their teaching and assessment approach to combine them to become more programmatic and more friendly to the students.
Yeah, thank you. One last question before we wind up. One example of a data point and how to apply the principle of programmatic assessment is something they want to know. So maybe a little bit about this data points that will be useful. Okay.
Yep. As we discussed before, the data points actually any kind of assessment instrument that we used before. For example, we use MCQ as an example will be easier. And we usually, maybe all of us do MCQ examination for our program, right? Maybe for block examination, right? This is one data point. So we cannot say that, look, our students already master cardiovascular diseases because their examination, MCQ examination is 85, right? Because cardiovascular competency is very wide. It's not only knowledge. We have to combine this with different data point, which is maybe the skills of communication for cardiovascular patient using OSCE, and how they actually interact with patients with mini CX. So we should combine all of them together, right? And by those combination, we can see which part of the competency of cardiovascular that students actually need to improve. Oh, you are good with your knowledge, but unfortunately your communication need improvement. So this is something that we should aim for programmatic assessment. So not only doing each part of them, but combining them as a combined competency. And those data points is useless if we are not combine them with feedback. So that's why we mention feedback every time, because feedback is actually how we can use the data point. Because without feedback, if we analyze this with research, we can only have this table of data and we cannot interpret them into a learning process, right? And with our feedback, so our interpretation, so SONA, right? The A assessment process is our feedback, and then we can use the data from our data points for learning process of our students.
Thank you, Dr. Prattama. I think that was quite, I hope the participants have got a gist of what is to be done. And this is like the taste of pudding is in eating. We have to try this out and then overcome the challenges. And thankfully, as you told, faculty development workshop is the only solution. So thank you so much. And I request Mr. Lokesh to deliver the vote of thanks. Participants, please fill the feedback form that has been provided on the chat box. So Lokesh, over to you.
Good evening, everyone. On behalf of the UCHPE, I would like to extend our heartfelt gratitude to each and every one of you for joining us today for this international webinar on programmatic assessment for health professions education, why and how. We are truly honored to have had such an engaging and insightful session made possible by the expertise and dedication of our esteemed speaker, Dr. Utomo. Sir, your valuable insights and perspectives have undoubtedly enriched our understanding of Programmatic Assessment for Health Professions Education, leaving us with much to reflect upon and implement in our respective endeavors. We would also like to express our appreciation to all the participants for your active participation, thoughtful questions, and valuable contributions throughout the webinar. Your engagement has been instrumental in making this event a success. Special thanks to our extinguished leaders of the Academy, including our Honorable Vice Chancellor, Dr. Vengamma, Registrar Dr. D.V.L.N. Prasad, Dr. Prabhakar, Dean, Faculty of Medicine and Principal of Medical College, Dr. Dayanand, Dean, FH and BS, for their support and guidance. Lastly, a big thank you to our UCHP team and the technical staff for ensuring a smooth and seamless experience. As we conclude this webinar, let us carry forward the knowledge gained and continue to foster learning and collaboration in our communities. Thank you once again for your participation and enthusiasm. We look forward to welcoming you to future events.
Thanks, Dr. Lokesh. So my team, thank you profusely, Dr. Prattama, and also the participants who benefited from this session. And thank you once again. I expect future, I hope we could collaborate further with respect to that we would like to conduct with respect to PG programmatic assessment. Thank you, Dr. Thama.
Thank you. Have a good night and see you in other.
Or you have a
webinar.
good day. Yeah. Bye-bye.
Thank you very much.
See you later.
Bye.
Bye. Bye.
Bye, sir.